Skill: finding what's wrong in an alert, breathing person. After checking the area for dangerous hazards, make eye contact with the person, introduce yourself, tell him or her that you have first aid training, and ask if you can help. The person may give permission by saying yes or nodding his or her head. Ask, "What happened?" and "Where do you hurt?" Scan the body for any severe bleeding. If any is found, control it before continuing. If you suspect a severe injury, call 911 or ask another person to call. Often, the person receiving first aid can tell you what's wrong. However, using the simple acronym SAMPLE will help you recall what questions to ask. S stands for signs and symptoms. Ask, "Where do you hurt?" A stands for allergies. Finding that the person has allergies could provide a clue as to what could be wrong. M stands for medications. Finding that the person is taking any medications could also provide a clue as to what could be wrong. P stands for pertinent past medical history. Ask, "Have you had this problem before? Do you have any other medical conditions?" L stands for last oral intake. Determine when it was consumed and what it was. Finally, E stands for events leading up to the illness or injury. Most people receiving first aid will need only an exam of the body part that they are complaining about, which is known as the chief complaint. A full body exam is not often needed. However, checking the entire body may result in the discovery of a problem that might otherwise have been overlooked. When checking a chief complaint or performing a full body exam, use the DOTS acronym, starting at the head and working toward the toes to help you remember what to look, ask, and feel for. D stands for deformity. Does a body part have an abnormal shape? Compare one side of the body with the other side. O stands for open wounds. Is the skin broken and is there bleeding? T stands for tenderness. Ask the person if a body part is sensitive or painful when touched. S stands for swelling. Does a body part look larger than normal? Compare one side of the body with the other side. When checking the person receiving first aid, you should also look for a medical identification necklace or bracelet on the person's neck or wrist. The necklace or bracelet will have a tag that contains the person's medical problems and a 24-hour telephone number. Knowing that the person has a medical condition can sometimes help identify what is wrong with the person.